nausea, dizziness, breast pain, delayed menstruation. There are many symptoms that, throughout our lives, may lead us to think that we might be pregnant. The most reliable way to confirm pregnancy, whether planned or not, is to take a test that you can find at any pharmacy or that your general practitioner can provide. Want to know more? We explain it in AllForBabies. How to know if you are pregnant in the early days. Some women use the method of body temperature to know if they are pregnant before taking the test. To do this, they record their temperature immediately upon waking up, without getting out of bed. When fertilization occurs, the temperature stays elevated a little longer than usual, and if it hasn't occurred, the body heat drops on the day menstruation should start. Nevertheless, in the early days of pregnancy, it is challenging to know for sure if you are really pregnant, as the only reliable way to find out is by taking a pregnancy test or a blood test. The vast majority of pregnant women will experience some symptoms at the beginning of pregnancy, but others may not. The most common ones are delayed menstruation. This is the most characteristic sign and typically raises all suspicions. Nausea. When a woman becomes pregnant, hormonal changes affect the perception of smells and tastes. Therefore, experiencing nausea and vomiting, especially in the first weeks of pregnancy, is normal. Breast pain. Breasts undergo significant changes from the beginning of pregnancy, and breast pain may be the first symptom before the absence of menstruation. Ovarian pain. The lower abdomen may feel uncomfortable due to the changes occurring in it. It's as if menstruation is about to start, but it doesn't. Fatigue, tiredness, and sleepiness. A woman's body prepares to nurture life inside, resulting in excessive tiredness, making the woman want to lie down a significant part of the time. Dizziness. Generally, this happens because of low blood pressure or low blood sugar, demanding food. It's all due to hormonal changes, more common in the first weeks. When to take a pregnancy test. The pregnancy test measures the concentration of human chorionic gonadotropin hormone in the blood, which, in the case of pregnancy, begins to increase very rapidly. There are more sensitive pregnancy tests than others, able to detect pregnancy days before menstruation is due, but it's most reliable to perform it from the day your period should start. This way, you will ensure whether you are pregnant or not, and you will also save money if you don't have to repeat it. How to take a pregnancy test. To take a pregnancy test, it is best to follow the manufacturer's instructions. Nonetheless, they all work practically the same, requiring you to urinate directly on the indicated area of the test or inserting it into a container where you have previously collected urine. It is advisable to do it in the morning, as the hCG hormone is more concentrated. Once done, just place the test horizontally and wait a few seconds. How to interpret the pregnancy test result. If only the control line is marked, the test is negative. However, if a second line appears, you are pregnant. In the case of using a digital test, the result will be displayed on the screen. Now you know how to confirm if you are really pregnant. What are you waiting for to take the test? Are you eager to have a baby? Tell us in the comments. See you in the next AllForBabies video.